Welcome to Health with Alizai, where we provide you with the best health tips and advice for a better, healthier life. Today's video is focused on a common yet serious issue that affects many people: chest diseases. We'll be covering everything from the causes and symptoms to effective treatments, including both conventional medicine and natural remedies. Stay tuned as we dive into the details to help you understand how to prevent and manage chest diseases effectively. Chest disease, a comprehensive guide. Chest diseases can impact the lungs, airways, or the area around the heart. If not treated properly, these conditions can lead to serious complications. In this guide, we will explore various types of chest diseases, their causes, symptoms, and both conventional and traditional treatments that can help alleviate the condition. Types of chest diseases. 1. Pneumonia, an infection in the lungs caused by bacteria, viruses, or fungi, leading to inflammation. 2. Bronchitis, inflammation of the airways, causing persistent coughing and breathing difficulty. 3. Asthma, a chronic condition where the airways narrow and swell, making breathing difficult. 4. Tuberculosis (TB), a bacterial infection that primarily affects the lungs. 5. Pleurisy, inflammation of the tissues lining the lungs and chest cavity. Symptoms of chest diseases. Each chest disease may present its own set of symptoms, but common signs include: 1. Breathing difficulties, shortness of breath during regular activities or at rest, chest tightness or discomfort while taking deep breaths. 2. Cough, persistent, dry, or productive cough, possibly with mucus or blood. Coughing that worsens at night or in the early morning. 3. Chest pain, sharp or dull pain in the chest, especially when breathing deeply or coughing. Pain that radiates to the shoulders or arms. 4. Audible breathing, wheezing or whistling sounds during breathing, a rattling sound due to mucus buildup. 5. Fever and sweating, high fever, especially at night. Excessive sweating, often accompanying fever or after physical exertion. 6. Mucus production, yellow, green, or blood-tinged mucus expelled through coughing. Increased production of mucus, blocking airways. 7. Shortness of breath, difficulty breathing even after mild activities, such as walking. Breathing problems while talking or eating. 8. Fatigue and weakness, feeling unusually tired even after adequate rest. Lack of energy to carry out daily tasks. 9. Sleep disruptions, difficulty sleeping due to coughing or shortness of breath at night, waking up frequently gasping for air. 10. Additional symptoms, loss of appetite and unintentional weight loss. Bluish tint to lips and nails due to lack of oxygen, cyanosis. Physical signs of chest diseases, bluish lips and nails, a sign of low oxygen levels in the blood. Chest swelling, inflammation around the lungs or airways may cause swelling in the chest. Facial swelling, especially in TB cases, swelling around the eyes or face may occur. Weight loss, particularly in long-term conditions like TB or chronic bronchitis. Causes of chest diseases. Several factors can contribute to chest diseases, including: 1. Infections. Viral, bacterial, or fungal infections can cause inflammation and damage to the lungs and airways. 2. Pollution and smoking. Exposure to pollutants or smoking weakens the lungs and increases the risk of diseases like bronchitis and asthma. 3. Allergies. Allergens such as pollen dust or pet dander can trigger asthma or allergic bronchitis. 4. Genetics. Some chest conditions like asthma can be hereditary. 5. Weak immune system. Individuals with compromised immune systems are more prone to infections like pneumonia or TB. 6. Narrowing of airways. Conditions like asthma or chronic bronchitis cause the airways to narrow, leading to breathing difficulties. Treatment of chest diseases. Conventional treatment. 1. Antibiotics. For bacterial infections like pneumonia or tuberculosis, antibiotics are essential. 2. Bronchodilators. Medications used to open up the airways for easier breathing, especially in asthma and bronchitis. 3. Steroids. Help reduce inflammation in the airways, particularly in chronic conditions. 4. Oxygen therapy. For severe cases where oxygen levels are low, additional oxygen may be provided. 5. Vaccination. Preventive vaccines for diseases like pneumonia and TB can greatly reduce the risk. Traditional remedies. 1. Honey and ginger. Honey has anti-inflammatory properties, and ginger helps to soothe the airways. How to use. Mix 1 teaspoon of ginger juice with 1 teaspoon of honey. Take this twice a day to reduce coughing and inflammation. 2. Fennel and carom seed tea. This herbal tea helps in clearing mucus and reduces inflammation. How to use. Boil 1 teaspoon each of fennel and carom seeds in water. Drink this tea once a day for relief. 3. Cloves and cinnamon. A tea made from these spices can ease congestion and open up the airways. How to use. Boil a few cloves and a cinnamon stick in water, strain and drink once daily. 4. Turmeric milk. Turmeric is a natural antibiotic and helps reduce lung inflammation. How to use. Add half a teaspoon of turmeric to a glass of warm milk and drink it before bed. 5. Steam inhalation. Inhaling steam helps clear out mucus and reduces nasal and chest congestion. How to use. Add a few drops of eucalyptus oil to boiling water and inhale the steam for 10 minutes. Chest diseases can vary from mild infections to severe, life-threatening conditions. Recognizing the symptoms early and seeking prompt treatment is vital for recovery. Both conventional medicine and natural remedies play a role in managing chest diseases. However, it's always important to consult a doctor to determine the best treatment plan for your specific condition. Thank you for watching this informative video on chest diseases. We hope this information helps you take better care of your health. Don't forget to like, share, and subscribe to Health with Alizai for more helpful health tips and remedies. Stay healthy, stay happy.